It sounds like science fiction, a single injection that can treat up to 15 different types of cancer, delivered in just 5 minutes. But this is no fantasy. It's happening right now in England. In early 2025, the United Kingdom's National Health Service began administering a revolutionary anti-cancer injection that promises faster treatment, less time in hospitals, and the same life-saving effectiveness as traditional therapies. This breakthrough marks a new chapter in cancer care, one driven not just by new drugs, but by smarter ways of delivering them. Today, we'll explore what this new injection is, how it works, who it can help, and why experts are calling it one of the biggest medical innovations of the decade. For decades, cancer treatment has often meant long hours in hospital chairs, hooked up to IV drips delivering chemotherapy or immunotherapy. These sessions can last anywhere from 30 minutes to several hours. For patients already battling fatigue, nausea, and anxiety, that's an exhausting routine. It also puts pressure on hospitals, nurses, infusion chairs, and oncology wards that are constantly full. And while these treatments save lives, they're not easy on the body or on the healthcare system. The NHS needed a way to make things faster, easier, and more efficient without sacrificing results. That's where the new injection comes in. In April 2025, the UK's Medicines and Healthcare Products Regulatory Agency officially approved a new injectable form of an immunotherapy drug called nivolumab, developed by Bristol-Myers Squibb. You might know it by its brand name, Opdivo. It's not a brand new drug. Nivolumab has been saving lives for years. But what's revolutionary is how it's now given. Instead of a slow intravenous infusion, patients receive a quick subcutaneous injection, meaning just under the skin, in the thigh or abdomen. And instead of taking up to an hour, the whole process takes 3 to 5 minutes. That's it. Nivolumab is part of a class of medicines called immunotherapies, treatments that empower the body's own immune system to fight cancer. Cancer cells are clever. They use certain proteins, like one called PD-1, to hide from immune cells. It's like putting on an invisibility cloak that tells your body, "Don't attack me." Nivolumab removes that cloak. It blocks the PD-1 receptor on T cells, reactivating them so they can recognize and destroy cancer cells again. In essence, it teaches your immune system to see the enemy once more. That's why drugs like nivolumab have been called game changers in oncology. They don't poison the tumor directly. They help your body fight back. Until now, nivolumab could only be given intravenously through an IV drip. It worked well, but it required clinical time, equipment, and long visits to hospital. The new subcutaneous injection changes everything. In a single dose delivered under the skin, patients receive the same amount of active drug as before, at the same intervals every 2 or 4 weeks depending on the cancer type. But instead of sitting for an hour connected to an IV, they can be in and out of the clinic in minutes. For patients fighting advanced cancers, this time saved means more time at home, more normal days, and less stress. And for the NHS, it means treating more people more efficiently with the same resources. The new nivolumab injection is currently approved to treat up to 15 types of cancer. These include lung cancer, kidney cancer, bladder cancer, esophageal cancer, stomach cancer, liver cancer, colon and rectal cancers, head and neck cancers, and melanoma, the deadliest form of skin cancer. In other words, it's not a single-purpose drug. It's a multi-cancer therapy, one of the most versatile immunotherapies ever developed. It doesn't replace all forms of cancer treatment, but for many patients, it is a faster and easier way to receive the same medicine they've already been relying on. Before this injection reached patients, it went through extensive testing. The approval came after a Phase 3 clinical trial known as Checkmate 67T, where researchers compared the injection to the traditional IV version. The study focused on people with advanced kidney cancer, and the results were clear. The injection worked just as well as the IV infusion. The levels of drug in the bloodstream were the same, the effectiveness was the same, and the safety profile was identical. Patients even reported higher satisfaction, saying it was less invasive, less stressful, and far more convenient. No new side effects were discovered. For regulators, that was the green light they needed. The MHRA approved it on April 30th, 2025, and within days, the NHS began rolling it out to hospitals across England. According to the NHS, England is now the first country in Europe to offer this treatment routinely. By mid-2025, hospitals in London, Manchester, Birmingham, and other major cities began using it for eligible cancer patients. The NHS estimates that around 1,200 people per month, or nearly 15,000 per year, will benefit from this faster, simpler injection. Even better, it costs no more than the older version. The NHS negotiated with the manufacturer to ensure the same price, meaning no extra burden on taxpayers or patients. That's a crucial detail, because making innovation affordable is what allows public health systems to evolve. Peter Johnson, the NHS's National Clinical Director for Cancer, called the rollout a major step forward that frees up valuable clinical time and improves patient experience. Ashley Dalton, the UK's Public Health Minister, said, "This innovation shows Britain remains a world leader in medical advancement." From the scientific community, Cancer Research UK applauded the move, with spokesman Naza Turabi saying, "Changes like this will be vital to treating cancer patients faster and more efficiently. We're living in a golden age of cancer research, and the NHS must evolve to deliver these breakthroughs quickly." From the regulatory side, MHRA officials stated that the new formulation met the highest standards of safety, quality, and efficacy, promising to continue monitoring it as it enters widespread use. The benefits go far beyond convenience. By cutting treatment time from an hour to just minutes, the NHS expects to free up more than 1,000 hours of hospital time every month, the equivalent of an entire year of clinical availability every single year. That means shorter waiting lists, faster appointments, and more patients treated. For those battling cancer, this time is precious. Every extra hour spent outside a hospital chair, at home, with family or simply living life, is priceless. So yes, the news is real. The NHS has begun offering a 5-minute cancer injection that treats up to 15 kinds of cancer safely, effectively, and faster than ever before. It's not a miracle cure, but it's a miracle of logistics and compassion, proving that innovation isn't always about new drugs. Sometimes it's about making existing ones smarter, faster, and more human. This is the future of medicine, efficient, patient-centered, and accessible to all. And as thousands of patients in England already experience this breakthrough, one thing is clear: the fight against cancer just got a little stronger and a lot faster.